Alongside his research, he directs the Summit Path, which is a performance psychology practice which invests in individuals, groups, and communities to enable shifts in mindsets and behaviors. Today, he's going to be talking to us about citizen science and health in the city. So please welcome David Buckley.
That's very kind, Richard. Hello, everyone. It's lovely to see some friendly faces, well, all friendly faces, but familiar faces and some new faces as well. Oh, can you hear me okay?
Yeah, can hear you.
Okay. Did you hear me just talking a moment ago? Because I had a bump note.
Absolutely.
Okay, brilliant. I had a
You're all
message
good.
pop up there. Super. Cool. So I'm just going to start by sharing my screen so that we get that practical side out of the way.
I'll tell you when that happens as well.
Yeah, that'd be
Don't
great.
don't
Yeah,
worry.
super.
We're all good. It looks like there you go. We're all good. I can see you in the corner there.
Okay, beautiful. Okay, so as Richard mentioned, so my name's Dave, and I am based at the Technological University Dublin in the Sustainability and Health Research Hub. And today, I'm going to be talking to you a little bit about citizen science and how it can be used to support health in cities. As well as this, I'm going to give you a guided tour of a few training resources that we're actually creating as a part of our work, so that we've got both a kind of a theoretical and a practical side to the subject. So to achieve this goal, we've got about 25 minutes. So in that time, I'm looking to kind of take off these kind of 5 key points, if you like. So initially, just to set the scene, just going to give a little bit of background and purpose behind, the inspiration for coming along and sharing this talk today. This includes a bit of an overview of a project that I'm working on at the moment, which is called the Go Green Roots project. After this, I'm going to give you a kind of a brief background into understanding the topic. So for those that aren't familiar with citizen science, don't worry, we're going to have the opportunity to have a short introduction, which essentially will get it's all on the same page with any of the key concepts or key terms, just at a kind of a basic level, so that we can kind of engage in purposeful conversation afterwards if we want to. Then after this, I'm just going to go through some of the tools and resources that we're creating and an overview of the training, before then giving an interactive demo of one of the particular learning units. In this learning unit, we're actually going to this is our opportunity to dive a bit deeper into how citizen science can particularly be there to support health. As Richard mentioned, and Dom's already popped some resources and projects in the chat already. It's quite a diverse tool. So this will give us opportunity really to hone in on how we can support preventative health solutions in cities. And then towards the end, we'll just wrap up by looking at what the top 3 takeaways might be and some next steps, thinking about how we might move into our discussion groups afterwards. So does anybody have any questions just before we dive in? Beautiful. Okay, so just to give you a little bit of a background into what was here. So the Go Green Roots project is a project that we're working on at TUD, and essentially the Go Green Roots project, the goal of this project really is to implement something called nature-based solutions. Okay, so we're working with 6 different European cities which are located in Bulgaria, Finland, Ireland, Estonia, Sweden, and France. And the aim really is to develop public green space in a manner that enables people to develop their health. So just to give you a bit of an idea of what these things can look like, if you're not familiar with that, is that in cities, there may be certain things like adding green walls, such as things on the right-hand side, there are figure 2, or they could be slightly different, more technological solutions. The one in the bottom left of the picture is actually something called street trees. So these are actually inside these cabinets, if you like. There's a layer of moss, and essentially a motor runs through and it sucks in air through the moss, which then filters the air. So these trees are actually placed in different locations in the city of Cork, and they're placed at different places around the city centre where there may be additional traffic use and usage to try and deal with additional air quality. So at the end of the project, what we're seeking is to develop a series of 6 different interventions in the 6 different cities that we're working with, and then to share our knowledge more widely with the other members of the network, which include Gezira in Malta, Munich in Germany, Murcia in Spain as well. So to give you an idea of what our interventions look like, we've got 6 in total, and because of time, essentially, we're not going to be able to go into too much detail with on each of them individually, but I thought I'd just highlight some of the key ones, just so you've got a bit of an idea of what the project's about. So firstly, I want to point to the one in Lahti in Finland. So this intervention is actually adjacent to a hospital. And what's actually being built there is that there's a series of different walkways which are going through an area of forest which sits adjacent to the hospital, which enables basically patients to be able to use that facility as a part of their outpatient care. In contrast, in Limerick, the NBS intervention is more to do with it being a more traditional greenway. The greenway is actually 3.5 meters wide. It involves a cycleway and a footpath, and extends for approximately 800 meters. What this enables is it connects 2 parts of the area, which are very busy. One end has a secondary school and a series of kind of shopping center there, with a smaller shopping center and a neighborhood park, which is also next to a primary school. Previously, essentially, until this greenway was put in, people had to walk all the way around on a busy road to move between those 2 centres of the community. So by placing this route in the heart of the community, what it enables is that it allows people to move more freely and more safely between those 2 areas. So the reason why I wanted to just pop that in there was really to understand what the purpose of citizen science is. So in this project, what we're using it is a key strategy, which is particularly centered on actively involving people in gathering data, which essentially is to increase public support for each of these different interventions. And there's 3 ways that we're using it. Firstly, it's creating citizen leadership opportunities. Secondly, building community partnerships. And then thirdly, raising public awareness of particular risks, whether it's air pollution or benefits such as access to increased urban green space, with the ultimate aid of empowering local people in decision making. And at the heart of this, and why citizen science is such a key tool, is that participatory processes, which are those processes that involve stakeholders in design and making interventions, are a key feature of nature-based solution planning and implementation. And this is really because they enable the solutions to be adopted more widely and be more accepted by the citizens themselves. The challenge that we have is the fact that although this is a great thing in principle, and there's a lot of theoretical research on this, actually implementing this into practice is more complicated than it sounds. And actually affording the control to citizens, particularly in support of developing MBS and implementing these types of solutions, is something which is currently unknown. So that's where our role at TUD comes in within the project, and we are developing a citizen science training program. This citizen science training program aims to bridge this gap, and it provides guidance on 9 different citizen science activities that can be used to better understand nature, health, and the urban environment, with the ultimate goal of bringing positive change in communities. It's our aim that after the training, that delegates will be able to have a good understanding of citizen science and also be able to actively participate in monitoring these nature-based solutions for urban health in cities. It's a part of what we, in the project of our KNOW program, which is actually combined with a series of other innovative learning tools, which also seek to foster psychological resilience, sustainability, and nature connectedness. So in terms of today's chat, these are the 3 goals that I was hoping to only share with you, essentially. Firstly was to orientate you towards some of the materials included in the training. Hopefully this will also then encourage you that you can actually use some of these materials in the future with your staff, friends, colleagues, and students and then also provide an opportunity for some bespoke advice and support where possible. So before we get to that, we need to understand maybe some of the key concepts that are underpinning citizen science. So if you're not familiar with citizen science, we're just going to start with what it is, okay? So broadly speaking, citizen science refers to the involvement of volunteers, which are often members of the general public, in scientific research activities. These are normally and typically conducted by professional scientists or research institutions, but not always. As a practice, citizen science is really, really diverse, and it can really vary depending on the kind of activities that you get involved in, the type of technology that people may choose to use, the scientific domains that are integrating these tools into their research, as well as kind of the duration and level of different volunteer involvements, expanding across geographical scales, as well as having different results and impacts. So at this time, within the landscape of citizen science, there's a lot of different terminology, which can be difficult to kind of get our head around and understand and be able to navigate. However, even if you're new to citizen science or you use citizen science regularly, a useful kind of starting point for understanding what it is the Oxford English Dictionary definition. So in 2014, it did actually enter into the Oxford English Dictionary underneath these principles of it being a scientific tool which involves the general public in research. So I just wanted to cover off some reasons as to why citizen science might be important. And this in itself could be many, many hours of talking about it. But just to give you a bit of a taster and a highlight of the breadth and wide opportunities that using citizen science can bring is really across 4 key areas. So there are benefits that it has for science. And then there's also benefits that it has for policy. It also has some wider benefits to society, and there's also opportunities for the participants themselves to benefit. So for an example of how science can benefit is that it enables research to be conducted over larger geographical scales and over longer periods of time. So for instance, in our project, we wouldn't be able to look at all of these different 6 cities in different locations if we weren't using this tool. On the policy front, it serves us to be able to facilitate greater public engagement in decision-making. From a society perspective, and particularly maybe some people in the room with an interest in this theme, is that it offers an opportunity to develop societal transformations, which is particularly relevant towards sustainability and health. So it can be used as a key tool, particularly in terms of monitoring such things like the SDG targets for the Agenda for 2030, which without the introduction of volunteers, monitoring those targets is very difficult and challenging. So citizen science is actually a key tool that may be able to support with that. And then finally, there's also a whole host of benefits for the participants themselves, both from kind of a knowledge and learning point of view, but also as a health intervention as well. So for example, some people may have come across the term social prescribing, which is community-based activities which doctors can actually prescribe as a part of long-term care plans. There's work going on to establish citizen science as an activity that may be able to be included in these long-term care plans because of the nature of the benefits, the social and exposure to nature contact that actually can come with these activities that actually can have direct and indirect benefits to people's well-being. So although citizen science has really grown rapidly, particularly in the last kind of 5 to 10 years, I just wanted to make to capture the picture so that you're kind of aware that it's not necessarily something that's hugely new in terms of a scientific tradition, but the term is something that only really kind of took hold from the mid-1990s onwards. But if we look at the historical aspects of citizen science, we're actually looking at going back a long way in time. So originally, even before science was professionalized, citizen science in its earliest form could be traced. So, and this is really to the era of the gentleman scientist. So some of the big wigs and the big names that we've all have heard of, Darwin, Einstein, and Tesla, they could all be classed technically as citizen scientists, because often their work was unpaid and they often weren't affiliated with any kind of university or professional scientific institution at the time of some of their biggest discoveries. It wasn't until the 1660s, with the establishment of the Royal Society in London, that it actually started to kind of build a community around science. This then led in the 1800s to the professionalization of science, where there was the creation of salaried positions for work within scientific field, which was particularly taken up with biological recording and observations in weather monitoring. This has then evolved into the new millennium in the 21st century to something we call the open science era, which involves kind of open access, open data, and open source software and sharing methodologies. Essentially, what this looks to do is to challenge the more traditional elitist parts of science, where it's about kind of ownership and restricting access to certain scientific knowledge, which can lead to power imbalances. A classic one would be the difference between some economies in the Western world are able to advance more technology at the expense of other developing nations, maybe in the global South, as an example. Open access allows essentially people from other places to be able to read this research. And it's a really key principle in terms of actually trying to share the knowledge more widely. And citizen science is seen as a really key tool in enabling this wider open science movement, which has the ability to share data and create solutions to some of the large complex issues that we have. So just to give you a flavor of who were the kinds of peoples that participate in citizen science, and it really is something which really targets a wide breadth of involvement from lots of different types of people. So this can include amateur enthusiasts, students and educators, members of communities, retirees and seniors, as well as NGOs, families and youth groups, government agencies, online communities, and particularly underrepresented groups. So these might be marginalized communities which struggle to have a voice in other parts of policymaking decisions, as well as purpose-driven businesses are now more broadly looking to integrate this, particularly in terms of from a program evaluation point of view. So in terms of actually understanding what citizen science is, it's like I say, there isn't necessarily a unified definition of exactly what it is at the moment. And it's also characterized by a whole plurality of different methods and disciplines and understanding, different ways of understanding and interpretations of how you can use this tool. So instead of actually really defining it down in terms of and saying that this is exactly what it is, instead, what the community has done is come up with two particular documents, which I'd like to point you towards, which I'll share afterwards. Which I'll drop them in the chat as well. And these essentially are a great go-to if you are wanting to decipher some of the more technical details around citizen science. So firstly is the 10 principles of citizen science, and which provides a set of standards for guiding good practice. It's a flexible framework which allows you to adapt it to your particular situation in different disciplines. And it's also available in 26 different languages at the moment. About 5 years later, the European Citizen Science Association, which is the author of both of these two things, published something called the Characteristics of Citizen Science, which also complements the 10 principles. And what this does is gives you a series of characteristics which help you determine what characteristics may be most relevant to your own particular situation in terms of your own project and aims. So for any studies you were looking to understand maybe what is citizen science and whether your project may be a citizen science project, you can use the 10 principles. And then also if you wanted to learn how to create citizen science projects, then the characteristics of citizen science can be a really useful resource for those. They're both PDF documents, so I'll share them so that you can go through them in your own time. So in terms of our training, the reason why we created this training is, broadly speaking, that citizen science projects, particularly those which are more citizen-led, often rely on training to safeguard the reliability and validity of the data collected by volunteers. And the challenge for many initiatives is that actually delivering this training adequately so that people actually know how to use the tool and actually effectively gather the data, it doesn't happen as much as is really ideally needed. As a consequence, new training programs are required, and these really are there to target this knowledge and skills to enable greater levels of public participation in the monitoring. From our point of view, that's more targeted towards assessing the effectiveness of nature-based solutions. However, this isn't the only place where you'd be able to employ this. The ultimate underpinning of this is the fact that we're looking to help integrate valuable knowledge from local people within the building of solutions which wouldn't have necessarily been included before. And it's this integration of the local knowledge rather than just relying on experts that helps build the public acceptance and ultimately will over time build to encourage mainstreaming of nature-based solutions within urban planning policies. So instead of just looking at executing economic models or developing solutions based on economic principles, that this offers another alternative for people to be able to use. So if you're interested in finding out more about it, essentially you can access the training online through one of our partners' websites, which I can share after the chat. So the training is actually designed for anybody with an interest in citizen science. And the aim is to provide access to information and resources to help build the capacity of citizen science, particularly with a focus on urban areas. And to facilitate this key goal of taking knowledge and putting it into policy action so that we can make a difference to health in cities. To do this, the training covers an introduction to the historical, theoretical, and practical foundations of participating in citizen science, particularly to promote health in cities. As a part of this, it gives an overview of the key issues which are influencing urban health and the importance of nature-based solutions in cities, as well as some background information on the research objectives and relevance of Go Green routes. After this, there's 3 skills packages, basically. The first one that offers directions on how to apply 9 citizen science activities to monitor nature-based solutions for urban health, as well as additional packages on providing guidance on managing groups of volunteers, as well as advice for planning, implementing, and evaluating these types of citizen science projects that promote health in cities. So at the end of the course, we want you to be able to explain what citizen science is and how it can be used to maximize public participation in research to support health promotion in cities. As well as this, you'll get an understanding of comprehending the various roles and responsibilities actually that are needed to be a part of implementing an effective citizen science project. You'll also understand the use of 9 different tools for monitoring nature-based solutions for urban health. As well as this, it will give the opportunity to develop a volunteer management plan to help you recruit, mobilize, and retain participants. As well as this, you can use it to create an implementation plan for carrying out a monitoring program at the city level if you wanted to. Okay. So although this is, again, I stress it's directed towards nature-based solutions, these resources can be turned towards other uses and purposes as well. So the training is structured around 5 different modules. And in the first module, you get provide the theoretical overview of the citizen science knowledge. Modules 2, 3, and 4 represent those different skills packages. So a monitoring toolkit for participants, a volunteer management handbook for facilitators, as well as a program playbook for coordinators of citizen science initiatives. Finally, module 5 looks at providing guidance and resources that people can use to create a record of their learning and then identify new opportunities that they can take part to develop in their citizen science practice in the future. So these are the different citizen science activities that are included, including how to measure air quality, noise, temperature, soundscape, green space quality, physical activity, green space usage, and biodiversity. And then finally, 360 health. So Richard, have we got enough time just for 5 minutes just to do a short demo?
Let's go for it. Yeah, absolutely.
So I just wanted, in this, it's all well and good just saying what's in it. So I'd like to just get, if it's possible, just share a little learning unit with you, just so you've got an idea of how things are structured. So there's two key principles that we wanted to keep in mind when we were developing this. So firstly, we wanted to promote learning by doing, essentially, and we wanted to see if we could develop a course that essentially that focused on developing people to actively participate by connecting learning with their real world situations. So to do this, each module tapers to a hands-on activity to help tailor the learning experience to each learner's circumstances, and also to give people like a practical takeaways so that they can put what they learn into practice. To deliver it, we've employed a technique called microlearning, which some of you maybe come across before. Essentially, what microlearning is about taking large bits of information and putting it down into bite-sized chunks. So each module is broken down into a series of smaller learning units, which we'll have a look at one today, that take approximately 5 to 10 minutes to complete. You can view each of these learning units as many times as you want to, from wherever you want to, through your phone or online. The aim of this really is that to combat something called the forgetting curve. So essentially, the more information we take in, as the distance between the times that we revisit that information, the more likely we are to forget certain bits of the things that we've learned. So in order what we do is that we make it easy for people to look at the material more often, which then increases engagement and theoretically retention of the knowledge in and of itself. So what I would do now is I'm just going to share my screen so that we can have a look at the beautiful. Okay. Can we see that one, Richard? Okay, so we just got here's an example of one of the modules that we've created, which is titled The Introduction to Citizen Science and Health in the City, which is our first module. So we're just going to take a little look at how citizen science can be used to support health promotion. So you can use this in different formats as well. If you want to look at it in your phone or on your tablet, then you can do. It's been designed with that in mind. We'll keep it in the web page at the moment, just in case. I'm not sure how it's coming up on each of your screens. But here to give you a taster of what each learning unit is structured and to also learn a little bit how we can apply it to promote health. So if you're not familiar with what health promotion is, health promotion actually talks about is the process of enabling people to increase control over and improve their own health. There are three key aspects of health promotion, which are particularly relevant, which include good governance for health, health literacy, and healthy cities. So you can straight away see how citizen science is a really well-made tool for achieving some of these goals. It's got a lot of these different similar goals to health promotion built into the structure of the tool. So why would we take a citizen science approach in health promotion? And it really centers around three kind of core buckets. Firstly, citizen science gives us the opportunity to harness resources for our projects that wouldn't have necessarily have been there. So this includes facilitating access to hard to reach data, provides new perspectives on problems and solutions, and also harnesses expertise and skills and passion from communities. At the same time, it also gives back to the community by engaging and educating and empowering people. So it does this by increasing public understanding of science, and particularly in terms of health, this can be particularly relevant towards chronic disease prevention. It also promotes public support for policies and also empowers communities in terms of building greater connections within communities and also people's confidence in order to be able to speak up on a particular issue or share their view. Finally, it can also be an important tool for contributing to change because it gives communities a chance to be a part of sharing in feeding into dialogue on the issues that really concern them. It also provides opportunities with evidence and tools to advocate for change. And then finally, it also means that it's a tool that can also be adapted very well to contextual and local factors, such as culture and language. So when we think from a health promotion point of view, one easy thing to point towards is really about the role of non-communicable diseases. So if you're not familiar with what non-communicable diseases are, these are the illnesses which are tend to be chronic, last for longer than a year. These account for 74% of all deaths across the globe, and more strikingly, 77% of those deaths actually occur in low to middle income countries. So we're beginning to see that disparity and imbalance there. So some of these big risk factors that we'd be familiar with, they won't necessarily be a shock, but these are the top 5 in relation to this would be tobacco use, nutrition, alcohol use, physical inactivity, and air quality. So all of these different risk factors are exacerbated, particularly by urban settings in certain circumstances, such as the expansion and of the number of people that are moving to live and work in cities. So in terms of actually how can you integrate citizen science, I wanted to just this speaks to actually the practical side of where you may be able to implement it in your project or business moving forwards. So at the heart of many of the activities citizen science is a part of, it's to do with monitoring and evaluating existing policies, but that's not the only place. So it can also be informed to identify problems from prospective community members, can be a really useful planning tool, and it can also be used as a co-design tool to develop programs and services, as well as actually feeding into the generation of policies and programs. Without that side of it, it can also be a great way of actually building relationships and community capacity to bring people together to drive local change. So if one thing is that there's many different ways that you can integrate it, in an ideal world, maybe in the perfect world, we do all of them. But even if there's you see an opportunity, then for one part of that cycle, then that's really going to be beneficial. So just to give you an idea of some of where it's been used to support health promotion before, one example, which is quite a nice one, is that I don't know if you remember, but in 2011, Eastern Japan was struck by a really large tsunami. And as a result of the tsunami, there was a meltdown of a nuclear power station. And as a result of that, that disaster, essentially, local volunteers took it upon themselves to set up their own local monitoring program to assess the radiation in the area. And this really was in response to essentially a lack of a response from the government. So cutting to a big chunk of the story out, but taking it to the end, is that essentially what using citizen science enabled them to do was to hold the government to account in order to not only inform their risk management decisions, but also then subsequently was used in a series of preventative policies that actually were there to deter whether we use what to do if this kind of situation arose again in the future. As well as this, it's actually grown to become the biggest and largest public data set on radiation anywhere in the world. So you can begin to see how those layers of multiple benefits start to integrate more widely when we see some of these key examples. So just in summary, in terms of this unit, so health promotion is a cornerstone of public health, and it prioritizes support for environmental and social interventions over individual behavior change and strategies. In terms of citizen science, how we can use it, it centers on this as a really valuable community engagement tool. So depending on whether you want to use citizen science, it can be a great point to consider, well, how much do I need the community to be engaged to be able to create an effective solution to this issue? And finally, although citizen science itself is growing, actually its integration into preventative health areas is definitely an emerging area. But there are plenty of examples of where we can use it, particularly to support things like physical inactivity, pollution in relation to contaminant exposure, and poor nutrition. But it's an area which it has a really high prospect of growth in the future. So finally, you can finish off by having a little quick look at a quiz below before moving on to the next unit. And I think we will leave it there.